What's going on, people? True G Fit. Uh, just wanted to talk about how to critically think about something, right? We have tons of people saying that this is the same as um, as many people are going to die from the flu as are going to die from COVID-19. Now, let's look at that in terms of critical thinking, right? In terms of numbers. From about the flu season goes about on for about 8 months, October to about May. And on average, some years are worse than others, some years are better than others, depending on the strain of the flu. But on average, 40 to 45,000 people die in those 8 months of the flu in America. That's without social distancing. That's without a stay-at-home order. That's with people mixing with each other in gyms and in work and in clubs and in bars, restaurants, everywhere, right? Think about that. 350 plus million people. So it's 45,000 deaths in those 8 months. Now, we saw our first case in the end of January, right? Confirmed case of COVID-19. It's about 3 months later, a little less than 3 months later, and we have close to 45,000 deaths in America. That's less than half the time that we will get to 45,000 flu deaths. In less than half the time, we were already there. And that's with social distancing in place, stay-at-home orders put in place, with the streets, jobs, gyms, restaurants, bars completely empty. And we are at 45,000 deaths. What that tells you is this is highly infectious and it's highly deadly. So in 3 months, with people barely even interacting or not interacting with each other, for 45,000 deaths, you can surmise that if we didn't put these systems into place, you would have 5 to 10 times more deaths. You can't really only say that the deaths are going to be because of the sickness itself, but because the hospitals and the healthcare system is going to be so overwhelmed, people are going to die just because they can't be taken care of. So they're going to die of other things, right? So not only are they going to die of COVID, they're going to die of the flu itself because they're not going to have the resources in the healthcare system to take care of them. They're going to die of cancer. They're going to die of heart disease, or whatever the case may be, of other diseases, because the healthcare system is going to be so overwhelmed they can't properly take care of these people. So you're talking about anywhere from 200 to 400,000 possible deaths if we wouldn't have done this. That's why they say hindsight is genius, right? Because when you can look back and analyze things, you can really come up with some real idea of why we had to do what we had to do and why we came up with these conclusions. But it's very easy to say, oh, well, we only have 45,000 deaths, you know what I'm saying? So it wasn't that bad. Well, it was that bad because we only had 45,000 deaths so far in 3 months, even with social distancing and stay-at-home orders put in place. Okay, think about that. I mean, this is what critical thinking is all about. It's about understanding this difference between one thing or another. These false equivalencies that people make about the flu COVID is exactly as the flu is really dumb, and it's really ignorant. It's not thought out, but it's easy to repeat somebody and regurgitate somebody else's ignorance instead of actually taking the time and the mental energy and effort to critically think about something. So it's not the same. The flu is nowhere as contagious as COVID-19 is, and is nowhere as deadly as COVID-19 is. And right now, I just broke it down and showed you why that is. And let's hope that because these people are opening up, some governors are opening up their states. Let's hope that we have herd immunity. Don't think that this is unprecedented territory. Just because states open up and they don't see a rise in cases, that doesn't mean they made the right decision. That means they took a risk with people's lives and they just happened to be right. Because what happens now is this disease has been around so much, maybe a big group of the human population in America has had some herd immunity. And so we're not going to see a second outbreak. But that's just being lucky. That's not And that's just calculated risk that obviously the president's taking and these governors are taking. Let's just hope that they didn't put thousands and thousands of lives at risk because they were, catering to the constituents. Anyway, critical thinking, people. Use that energy, use that extra energy you have to learn how to think and analyze things and see the differences between things that people are trying to make false equivalencies from. Okay? Thanks for listening. Trilogy Fit. Peace.